Today is National Black HIV and AIDS Awareness Day, which started as a grassroots movement to raise awareness of prevention, care, and treatment options in communities of color. Now, while anyone can get HIV, Black Americans are disproportionately affected. The CDC reports that while Black people account for 13% of the U.S. population, they made up 40% of people with HIV in 2019. On average, 1 in 16 Black men and 1 in 30 Black women will be diagnosed with HIV at some point in their lifetime. So let's bring in founder of the Black AIDS Institute, Phill Wilson, for more on this. Phill, thanks for being here. You know, CDC data shows that over the past decade, new infections have dropped among white, gay, and bisexual men, but remained flat among those who are Black, Hispanic, or Latino. Why are we seeing these higher rates to begin with? And then why aren't we seeing these numbers come down in these communities?
Well, thank you for having me, Diane. And, you know, the CDC recently released a report showing that Black people are disproportionately impacted by HIV on every level. We get infected at higher rates, as you just reported. We get sicker faster, we die faster. Interesting, you know, that's a report that has been released every year for the last 40 years. Now, so Black people have been disproportionately impacted by HIV since the beginning of the epidemic. It's kind of like Groundhog Day every February where we release this information. There are a number of fundamental issues that continue to exist. Now, high rates of poverty, now housing instability, the issue around discrimination, and a distrust of both the healthcare system and systems in general in the United States as Black people feel mistreated and facing all sorts of challenges.
Now, throughout the pandemic, we've heard a lot about the disproportionate impact of COVID-19 on communities of color. Is there a common thread here?
Yes, I think that there certainly is a common thread. You know, one would have hoped that we would have learned lessons from HIV and AIDS, and clearly we have, but we have not learned them well enough. For many of us in Black communities, we feel like it's deja vu. We feel like, you know, the same processes that we experienced in the HIV pandemic, we're experiencing in COVID-19. And now we're facing the dual epidemics. You know, what we see is that Black people who are living with HIV, or people in general living with HIV disproportionately, those people are Black, also face higher incidences of COVID-19. The severity of the disease with COVID-19 is greater for people who are living with HIV as well.
And so is there sort of one key area that needs to be focused on, you know, access to medication and healthcare, for example? What do you think is sort of one key place that communities and that leaders can focus on to try to at least get this going in the right direction?
Well, I think that we've been plagued with kind of fits and starts. And so if we want to have success in addressing the disproportionate impact that HIV and AIDS and now COVID-19 is having on Black communities, we have to have an all-out effort that is sustained and consistent over time. And that's not happened. No, we launch initiatives, and then those initiatives drop off, and then we launch new initiatives, and then those initiatives drop off. And so if we want to be serious about fighting both HIV and COVID-19 in Black communities, number one, we have to have an all-out effort. We have to be consistent about that effort. We have to engage the entirety of Black communities, inclusive of the LGBTQI communities, but inclusive of traditional institutions as well. We need to reinvigorate our energy to remind people, although we have had success with HIV and AIDS, the pandemic is not over. Now is not the time to lift our foot off the gas. Quite frankly, now is the time to press our foot onto the gas in a wholehearted, holistic manner.
And so what should people do to stay safe?
Well, number one, there are obviously advances we've made in treatment and prevention. Today, if you're diagnosed with HIV, science will allow you to live, quite frankly, a normal lifespan. Now, today, if you're diagnosed with HIV, there are treatments that actually can stop the progress of the disease in your body. On the prevention side, we have tools like U equals U, which means that if you're undetectable, you cannot transmit the virus. So both the treatment is a prevention tool so that we don't transmit the virus to others, We also have PrEP, pre-exposure prophylaxis, which allows people to protect themselves from acquisition of the disease. Now, we also need to face the issues around community activity and access to the disease, because although these treatments are available, the uptake is not the same in Black and brown and other people of color communities and in poor communities as they are in wealthy communities and white communities.
All right, Phill Wilson, great to have you, Phill. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.